Over the past year, as you know, I have shared my own story of addiction and recovery and have also been contributing to the work of the Arslanga Media Addiction Recovery Project. I am really excited to announce a new initiative that I'm helping produce along with the Abruptly Authentic team and others, Addiction Recovery Lorain County. We'll be going around highlighting the work of area addiction treatment providers and powerful stories of recovery from their patients. This first feature showcases the work of Dr. Patrick Beeman's Integrated Addiction Medicine and OBGYN program, Veranova Health at Cornerstone in Elyria.
I literally felt like my life was over, like there was nothing left for me. I had lost custody of my kids. I had lost my house like a year ago. If you would have seen me, I had no house, no car, no kids. I was just a mess.
The first job I got in addiction medicine proper was through the opioid treatment program where I met Tashia. And that first month interacting with those patients really opened my eyes and changed my entire worldview.
And so our mission is also to provide for those who are among the least of us. And that mission is what brought us together, looking to provide those medical services for women who are in Lorain County.
We love to welcome them, let them know that there's hope, that they're not alone, that we're going to walk alongside them.
Let's just start with your story. Let's start with that. Your recovery story and then your overall health journey.
I came to Dr. Beeman about 18 months ago, and I had just found out I was pregnant with Rihanna. I think it was like a week or two went by, and I had a doctor's appointment for her, and we did blood work, and it was supposed to tell if she was a girl or a boy, but they really didn't explain like that it would tell if like other things as well. And the blood work showed that she had Down syndrome. And all I really remember that day is the doctor, he was worried. I was crying and he wanted to make sure that I was going to get home safe. And I had a lot of decisions to make, he said. And it didn't really hit me at first until I got home and I thought about it, and I felt like I had ruined my baby, like I had did something wrong, and I ended up relapsing that day.
How does stigma affect whether women seek care?
I think it plays a huge role, even for me, like just not having people that knew about mental health, specifically providers that were comfortable with talking about that. It makes you not want to tell them about certain things or be honest. It's hard to find a provider that you know will be compassionate and caring and understanding. So I think just that in itself and not having a whole lot of major maternal services in our county has affected healthcare for women for sure.
A lot of our clients that we see of our pregnancies are unplanned. And that itself is very challenging. And someone that has substance use, a lot of times they're very, emotional, but also just lack of knowledge on what to do.
Talk about the transitions, the changes that you've seen over the past 4 decades.
Seeing that women who are facing unplanned pregnancies need more support than ever. And even as, we have helped women over the last 40 years, we have seen the client really evolve from a client who just needed that support when you came alongside of her, providing material services, now to clients who really need medical assistance.
After that, I called Dr. Beeman and on his cell phone actually, and it was at nighttime, and he answered, and I told him, I just said, because I relapsed in like a couple days went by. And then I called and I was like, you know what? It's time for me to get my stuff together and get sober. And he was like, well, come into the office tomorrow. We'll get you back on your medication and we'll talk about a plan and go forward. Then, the next day came and I went in and I got on medication and I actually changed my OBGYN to him. And then he started helping with the care for the baby. And that was the last time I used.
What about your experience with prenatal care? And obviously you're going through it right now, but even past pregnancies.
In my previous pregnancy, I actually did have a negative experience with a provider. I was honest about some things that I had done before my pregnancy, and that became the sole focus of our conversation. And I did end up having to switch care and kind of in the middle of my pregnancy. And I feel like it really changed the outcome. My pregnancy was a negative experience just because I didn't have that the medical professional on my side, and I felt like I was judged. So this has been a completely different experience, just not having the worry looming over my head that I'm doing something wrong or I have done something wrong. Just having informed conversations with the doctor instead of having any type of judgment.
We always approach our healthcare with knowing that it's more than just the physical, knowing that it's mental, and also we like to add spiritual for those individuals who do have a spiritual belief.
I want to start by talking about the history of Cornerstone and what you do for local families.
Cornerstone was established in 1986, incorporated in that particular year by a local worship pastor, Bill Williams, who felt a call to stand in the gap for women who were facing unplanned pregnancies. And so Cornerstone was founded to provide that support in parenting education and just to come alongside of a woman during a crisis period in her life.
Veranova came in and we started an integrated OBGYN and addiction medicine program. And we did the work to get it going, and a lot of it was preparatory, but we opened our doors, saw the first patient at the end of March 2025, and it's growing month by month.
And I know that Dr. Beeman's heart is to provide for care for women in Lorain County who may be those who fall between the cracks, those individuals who cannot provide for the services themselves. They don't have health insurance, or they are those who are on Medicaid.
Talk about what has stood out to you the most about the healthcare here in comparison to the past.
I feel like here it's very individualized, whereas in other facilities, I feel like it was just very rhythmic, go with the flow, like in and out, and not a whole lot of personal time, which I get it. People can be busy, or doctors can be busy. But here I feel like it's very thorough. The questions that I ask are always answered. There's always a follow-up. Like I said, very compassionate and caring staff. I've never had a negative experience here.
So our services here are at no cost. And so with teenagers, they can come in, they can get a pregnancy test, STD testing, and an assessment for free, and they don't need parental consent.
What I love about this outreach is that we take down those barriers so women can come in, find the care that they need, and then ultimately their health outcomes are improved.
I think that a program like this, with people motivated to put the work in, have a population that can be served in a real sense where we can, see them grow and alter the course of not just, the woman's life, but, really make an impact on families in our community.
We always want to make sure that when they come through the door that they know that they are valued. We have training to make sure that we are, listening, are able to listen, and have that emotional connection, emotional intelligence, so that we know how to respond to some of their needs without feeling judged. And we see that a lot. And we do a survey after they leave, and a lot of our clients will say, I didn't feel judged. They were really nice, So we try to make sure that they really are heard, that they know that they're valued, and they're not going to walk alone.
For those watching, scared, pregnant, what would you say to them?
Go get help. Find you a treatment center, a clinic, a doctor that deals with addiction, and call them and go get help. All you have to do is ask for help. That's the only thing you need. the first step to take is to ask for help. And once you get there, they'll handle the rest.